Good afternoon, everybody. I tell you, I was practicing this speech with my family for 3-4 weeks. I had 9 drafts. I'm not kidding. And every one of them criticized me. I have a son, I have a daughter, I have a wife, and all of them. At the end, I wasn't sure if they really liked me. But on my last draft, my wife told me, don't try to be charming. Don't try to be too witty or too intellectual. Just be yourself. So good afternoon, dear friends, business partners, and all members of the association. Frankly, I have known few greater honors than the opportunity to speak in front of this audience and serve as the president of the Florida Healthcare Association. I'm glad I did not have to present my birth certificate for this presidential election, which proudly makes me the first foreign-born FHCA president. I'm also lucky this time we did not have a contested presidential election. Otherwise, the Russian election meddling would have been obvious. I'm sure there are some people in the room asking, who is Alex Terentev? Where did he come from? Who is he working for? How did he become an FHCA president? And what is he going to do in this position? So I wanted to take a few minutes and answer some of your questions. And this is how my journey started. This is actually me 35 years ago. And I think I'm intending to use this picture for a pulse as a headshot. And this is where my journey started, back in the USSR. I'll skip over my childhood because talking about living in a communist Soviet country is not exactly a fun topic, and frankly, there is not enough vodka in this room for those stories. Later, when I went to medical school, one of my biggest accomplishments there was finding and somehow convincing this girl to go out with me as a teenager, and a few months later, still teenagers, we got married. Few months later, we got married. That is us. Because sometimes in life, you know when the time is right. 6 years later, when Soviet Union collapsed and the future seemed uncertain, we decided to move to the United States in search for an American dream, and in search also of a better life for ourselves and our young son, Paul. And on April 5th, 1995, a young couple with a 3-year-old son, 2 suitcases, and $120 in cash, barely speaking English, landed in Michigan. And I began working in a small hospital as a phlebotomist. And this is where our American dream started. I was making $10 an hour, but I felt filthy rich. Meanwhile, my wife Stella, who did not work because she did not have a work permit, she was sitting at home, but she found another way to contribute to our American dream. And on April 5, 1996, our daughter, Diana, was born. So here we are with 2 children, living a happy life in small Michigan town, when all of a sudden, our world almost ended. I learned that my work visa was not going to be extended. But giving up American dream and going back was not an option. We realized that our only opportunity to stay here legally was to become students and apply for student visas. And long story short, after years of working odd jobs like cutting grass and babysitting to pay for school, we both graduated from Lake Superior State University. At that time, American dream changed. I did not want to be a phlebotomist anymore. I spoke to a friend of mine, his name is Jim Wagner, who ran the only nursing home in our small Michigan town. And Jim suggested, Alex, pursue a career as a nursing home administrator. And Jim gave me an advice. He said, Alex, you're here on a student visa and you have a very funny accent. Your only way to find a job is to apply all over the country, from border to border, from coast to coast, and somebody's out there is going to be dumb enough to give you a chance. And that is how we ended up in Charles City, Iowa. I challenge you to find it on the map. I found myself surrounded by cornfields, running a 64-bed facility. And a true story, a few years before I started there, they had a hurricane. We lived in Hurricane Valley. They had a hurricane. Anybody knows what happens to a nursing facility that sits between the cornfields when hurricane goes across? You put all residents inside and hallways, you close all doors. When a hurricane passes, every resident room is filled with corn. True story. But you know you live in the middle of nowhere when the closest Walmart is 40 miles away. So after 3 years of country living, my family voted to leave Iowa and head for the beach. As luck would have it, in 2003, I found a job with my current company, Gulf Coast Healthcare, and we moved to Pensacola. Years went by. As a family, we moved from Pensacola to Orlando, and I'm still with the same company, and luckily with the same wife. And she went back to school and became a nurse practitioner. The children grew up, left home, and went to school. And my American dream changed again. I wanted to be the president of FHCA. Now, why I'm sharing all these stories? No matter how low or difficult your situation is, hard work will always get you where you want to be. I grew up in a country that pushed us down, and many of us still managed to get up. Paying for school was difficult, especially as immigrants, but we worked through tears and frustration because we knew what we were working for, the American dream. I would also encourage you to network with everybody out there. Meet people from our industry. Do not confine yourself to the walls of your own facility. The people I've met by chance ended up changing my life for the better. I ran the meeting in early 90s in Europe with American professor Bill Castor, gave me an opportunity for a life in the United States. I ran the meeting with Jim Wagner, helped me to become a nursing home administrator, and an email to Gulf Coast Healthcare helped me land a job in Florida. I work for a great company. Our company and our current and former presidents believed in me and supported all my FHCA activities, and I'm forever thankful to Jamie Richardson and Craig Robinson. Now, thank you. Now that you know who I am, let me tell you about where I want to take all of you. As your president, I want to focus on 3 areas that I believe are vital for our industry. Number 1, legislative activities, lobbying, and political involvement. For the past 8 years, we've had a strong relationship with Florida's governor, the House, and Senate, whose decisions affect our operations. This November, we'll see a new governor and new legislators elected to office. So it's critical that we spend these next few months educating them about the work we do. A new payment system, PPS, tied to quality is on the horizon. We need all of you to continue staying involved in FHCA legislative activities, coming to Lobby Wednesdays, hosting lawmakers in your facilities, meeting with them in district, and supporting the Florida Healthcare PAC is critically important. We have a great team in Tallahassee, but they cannot do it alone. So I challenge each of you to find your voice and be part of the political process. Number 2, improving the image of the nursing home industry. We are operating true rehab facilities, treating complicated clinical patients and sending them back home. We're not homes for old people playing bingo anymore, although I've told that bingo is very important. Educating lawmakers about the care we provide is one step toward changing the image of our profession. We also need to be willing to share our positive stories with our residents, our staff, our families, and everyone in our lives. Social media has transformed the way people get their news today. Like it or not, we must engage on Facebook and Twitter to tell as many followers as we can that we're no longer the nursing homes of yesterday. We have a workforce crisis. Today in the country, we actually have more vacant positions available than the number of unemployed people. Think about it. And while there is no silver bullet for how to fix the shortage of nurses and CNAs, we can certainly help our cause by telling stories about how important and rewarding it can be to work in our centers, to care for our residents, and to be part of a passionate team of caregivers. And number 3, continue to improve quality of care, outcomes, and relationship with AHCA, CMS, and other agencies. FHCA Long-Term Care Survey Task Force has been an important part of strengthening the relationship we have with the agency. And FHCA is working hard to keep those lines of communication open with all the agencies that are providing oversight. At the end of the day, we all want the same thing: the best possible care for our residents. So I plan to continue what John Simmons started with this task force, and we will expand opportunities for members to participate and share ideas as well as concerns. Being involved in FHCA for so many years, I've seen the transformation of this organization from an association without a strength and a voice at the Capitol. But today, I see a very powerful and strong group of leaders. Today, we have the highest level of participation from CEOs, owners, presidents, corporate staff, and clinical leaders. We celebrated 10 years of the Florida Leaders Program yesterday. And in January, we will begin, thank you. And in January, we will begin another leadership training program for our nurse leaders. All of this is something to be proud of. There are opportunities for involvement at the district or committee level. There are meetings and educational events that you can participate in. This is what makes us strong. The FHCA team with Emmett Reed leading the pack is the best in the country, but they need our help. I hope each of you will find a way to be involved and support your efforts. I'd like to tell you something that has helped me in believing in myself. Research shows that 1 out of every 3 people is either extremely smart or stunningly beautiful. Now look at the person to your right. And now look at the person to your left. It's definitely neither of them, right? So it must be you. I look forward to meeting all of you smart leaders this evening. It's going to be a great year, and I'm excited for what we'll accomplish together. Thank you for the opportunity to serve as your president. Thank you.
You killed it, man.
Thank you. I appreciate it.